eyelid surgery about 6 weeks ago, and I was a very nervous patient. I had a real phobia, I do have a phobia of needles, and Dr. De Silva has asked me just to record about my experience with the anaesthetist and how the sedation worked. It was done at the Hammersmith clinic on a kind of procedure that took an hour and a half. Before the surgery actually happened, the anaesthetist came up. He was a very kind of sympathetic man, you know, really kind of caring. He was explaining what drugs he was going to give, and if it wasn't, you know, he would be there by my side, you know, if I needed more sedation or more drugs. So we went and had the procedure, you know, and he's, you know, kind of put a little, whatever it's called, what's that thing called that you put in the, you know, anyway, the needle in the arm, and it was a really, I wouldn't say it was a lovely procedure, but it was, the thought of the anaesthetist and the sedation was a lot worse than the actual reality of it. After the procedure, I mean, I do kind of recall, I was told, oh no, you won't remember anything, it'll just be like being asleep. But in fact, I did remember, and, you know, he was, you know, I recall a conversation, and then I don't recall anything. So after the procedure, he was, you know, kind of there, and he's all holding your hand and sympathetic. Left, and he had a follow-up call that evening saying, you know, how's it going and all of that, and that's my experience of the sedation. Before I had eyelid surgery, I had to haul up my top eyelids to pluck my eyebrows. They were literally hanging on the top of my cheeks. Now I can see, look at my eyes, they're all big and gorgeous, and it's one of the best things I've done in my life. That's that. But I really would highly recommend it, and I have to say, I'm not being paid to say this. This is of my own volition, and I was just asked would I record my experiences for Dr. De Silva, and that's it. Do it. It will just revolutionize your life. That's that.